I'm here today with Dr. Sean Drummond. He's an associate professor here at the University of California, San Diego, and he's a clinical psychologist here in the VA San Diego healthcare system. We'll be talking today about cognitive behavioral therapy for insomnia. And we invited Dr. Drummond to join us as he is a well-known researcher in the sleep field. Also, he has extensive experience providing behavioral sleep interventions to veterans here at the VA San Diego. Dr. Drummond, can you briefly tell us what you'll be talking about here today?
Sure, I'd be happy to. As you probably know, insomnia is defined by two sets of symptoms. One, when somebody has problems falling asleep or staying asleep, and two, when they have some sort of daytime difficulty that they attribute back to their nighttime sleep problems. And chronic insomnia is reported by about 4 to 22% of the general population. And the prevalence is higher in some groups than others. For example, individuals with post-traumatic stress disorder or major depression or chronic pain often experience much more insomnia than somebody without those conditions. And what I'm going to be talking about today is the model that we use to understand how insomnia develops and is maintained. And I'm going to be talking about some of the treatment strategies we use when we're working with patients with chronic insomnia.
Well, let's get started, Dr. Drummond. What are we looking at here?
Well, clinicians who provide CBT for insomnia use something called the four-factor model to understand how insomnia first develops and how it's maintained over time. And CBTI clinicians also use the four-factor model to identify targets for treatment.
So what is the first factor in this model?
Well, we call the first factor predisposing factors, and these are things that can put somebody at greater risk for or make them vulnerable for developing chronic sleep problems. And these can be biological or psychological or even social.
So thinking about this model, what do you think put you at risk for insomnia?
Well, I don't know, but I know my mom's side of the family, a couple of people have sleep problems. And ever since I can remember, I've had a lot of thoughts running through my head at night.
I mean, those are two of the most common risk factors that people report for having insomnia.
So, Dr. Drummond, does that mean that everybody with some sort of predisposition to sleep problems will eventually develop insomnia?
No, it doesn't, but that's a good question, and it leads into discussion of the second factor in the model called the precipitating factors. Precipitating factors are really any kind of stressful situation where somebody might very understandably have the stress response or they have difficulty sleeping for a little bit of time. And again, these can be biological, like developing a medical illness. It can be psychological, like experiencing some sort of stressful event that makes you worry a lot. Or again, even social, like having relationship difficulties.
So can you tell me a little bit about what stressors were going on in your life right before you started having trouble sleeping?
Yeah, it kind of all started about 6 months ago when I got a pay cut at my job. It was fine at first, but then I found out that my wife was pregnant. And that's awesome and everything, but I have no idea where the money is going to come from for the new baby.
Wow, yeah. So, okay, so within that, when exactly would you say that you started having trouble sleeping?
I would say maybe about 6 weeks ago when I started ruminating over the money. That's when it started.
It looks like the third factor here is called perpetuating. That sounds like it refers to something that means sleep problems keep going.
Yeah, that's right. Perpetuating factors are the factors that we believe maintain an insomnia once it has already developed. And these are behaviors that some people do that cause what would be a short-term problem to turn into a long-term sleep difficulty. And when I conceptualize perpetuating factors, I think of sort of 4 classes of factors. There are things that people do in order to try to get more sleep at night, like go to bed early or maybe drink alcohol. Number 2 is things that they do during the day to try to compensate for having a bad night of sleep last night, like drinking lots of caffeine or napping. The third type of perpetuating factor is things that people are doing when they're in bed awake, but they would rather be asleep. So maybe watching TV or lying there worrying and ruminating about what's going to happen tomorrow, playing on their smartphone, things like that. And the fourth kind of perpetuating factor are physical or mental health problems that develop that can tend to make the insomnia worse.
Ah, that's what's going on.
What do you typically do to make up for feeling so tired and so foggy during the day?
That's a good question. I usually have a cup of coffee in the morning just to get me started. And actually, it turns into 2 because I'll have one around 11 or 12 just to stay awake. And then, you know, sometimes if I can work it out at work, I'll sneak a nap in my car, try not to get caught, you know, just to make up for some sleep.
Yeah. Is there anything else that you do?
I mean, I do use 5-hour energies. I don't know if you've seen those, but like,
Yeah, I've seen them.
I use 5-hour energies sometimes, and on the weekends it's actually better because I can stay in bed as long as I need to, like after I wake up. So sometimes I'll just lie there. I actually have no idea how I'm gonna get away with that when the baby comes, though.
I see the fourth factor is called conditioned arousal. What is this and how does it develop?
Yeah, conditioned arousal is, as you say, the fourth factor in the model. And the interaction of precipitating events and perpetuating events can lead somebody to be spending a lot of time in bed awake. And in fact, most perpetuating factors have as an end result the person spending a lot of time in bed, not asleep, and doing other things. For example, often what happens when somebody is lying in bed is that they lie there and become frustrated and angry and upset that they can't sleep. And conditioned arousal develops when essentially we start to pair together the stimulus of the bed with the response of being awake and alert. And so rather than the bed being associated with being sleepy and relaxed, the bed becomes associated with being awake and alert and frustrated and worrying.
Okay.
One of my main problems is that I end up dozing off on the couch. My wife wakes me up and tells me to go up to sleep, but the kind of frustrating and confusing thing is that once I actually get up to my bed, I'm wide awake and I can't get to sleep. So I've just started sleeping full-time on the couch.
Well, Dr. Drummond, what happens next?
Well, so this is basically where treatment starts. And